I'm going to be doing tracheostomy care and suction today. First, I would introduce myself to the patient. I would verify the orders, provide privacy for them. I would also be making sure I explain the procedure that's going to be performed, answer any questions, and I would also make sure I obtain verbal consent to perform trach care if they are able to speak. I would raise the bed to the level of my hips, place patient into a semi-Fowler or Fowler's position, whichever one seemed more comfortable. So now I'm gonna auscultate lung sounds for my patient. So I don't actually have any of this equipment, obviously, but so I'm just going to go ahead and explain to what I would do. So I would increase the supplement oxygen flow for the facility's policies. I will perform hand hygiene. Okay. Put on any PPE if necessary. So then I'll make sure I go ahead and prepare my supplies. I put on sterile gloves, but I don't actually have a pair of sterile gloves today. So I'm going to go ahead and just put my gloves on here. Okay. Gloves are on. So now I'm going to go ahead and do my catheter here. On my dominant hand, I would coil it around there. Okay, it's a little long, so I'm just going to do a little bit like that video showed me. Okay. With my non-dominant hand, I would turn on the suction device. So this is where I would self-contaminate purposefully to turn on all my stuff. So I'm gonna check I turn it on there, and this would be over here. So then I'll go ahead and connect the two together. My thing there. Okay. I would then dip it into some saline to make sure it's working and suctioning correctly. Then I will go ahead and turn on, I need to put it in my right hand, sorry, that's my dominant. Okay, so I put all that in there, and I'll turn the suction machine on. I would put it in sterile saline to make sure it's suctioning correctly. Then I'm gonna go ahead and remove the mask here. I should have already had that kind of pulled out. Okay, just kind of set it over here. Okay. And I keep touching this, so I already contaminated this hand, so I would not be touching this. Dominant hand inserts the trach into the trach, so I can hold it over here. So I'd bring it up. And then I would, it says here I would put resistance, but in the video it said I would not. So I'll just stick it in there, and I would not be having the suction on, so the suction would be off right now while it's in. Then I would suction and pull it out, kind of circle it around in there a little bit and take it out. Patient might cough, so I'll go ahead and recoil this back around. And then I do sterile saline again. Kind of get it all cleaned out. And wrap it around my dominant. And I would do that again, I would make sure I do that for 2 passes, no longer than 10 or 15 seconds in each one, or for each one. So then now I'm pretty much finished, so I'll go ahead and just unconnect this guy here. And then I would take my gloves off. Okay. And throw that away into the proper trash receptacle. Okay, I'm gonna keep these gloves. I would not reuse them, but I'm gonna go ahead and use them again since I don't have another pair. Oh, I have to put this guy back on. Okay. be the suction portion. So now I'm gonna go ahead and move on to tracheectomy care, which would be a dressing change and cleaning the inner cannula. So I'll get all my stuff together, perform hand hygiene, would open the kit at the bedside, but my kit's already open, so I have my kit here. All right. Go ahead and put on sterile gloves on my non-dominant hand first, which I don't have any sterile gloves with me, so I'll go ahead and put it on my left hand here. And then same with my dominant. Okay. Okay. So then now I will drape the patient. This won't stay very well with my little guy here, so I'm just gonna act like it's on him. Sorry, it's not gonna stay very well, but it would be draped over the patient. Also make sure I loosen this guy here. Okay, keep it there still so I don't have to move it just yet. Then I will take gauze, not this one, and I'll make sure I get it a little wet there for cleaning in an applicator to get it all clean there. Go ahead and remove the old dressing. I don't have one in here, but I would remove the old dressing. And then I will take stuff with my sterile saline, and I get it all cleaned up in there. Around. Okay. Then I would discard of that. Okay. Oh, guess I did that wrong. Okay, so back up. I would get everything ready to go as far as getting it clean. I would remove the cannula first. So twist it there, pull that guy off. Then I would insert a new one. The video shows that there's two different kinds, that there's a disposable or a reusable one. So if I was using a reusable one, I would obviously clean it really well, get inside this guy here and clean it with some saline, dry it out, and then I would insert it after it was all dry. Okay, so I'll put a new guy on there. Turn it till it clicks. You can feel it or you'll be able to hear it, but with this one obviously you won't be able to. Okay. Okay. Then now I would clean it. So I would use the little applicators that I got here. Clean this guy all out of here. All around in there. Get him all cleaned up. Then I would dispose of that. So he would be all cleaned up now and new inner cannula in, sorry. Okay, so now I will put the dressing on there. Okay, move this guy out of the way. Okay, put it under there. My tape isn't really working very well, so this would actually be underneath that little part there, the face of it. Make sure it's all secured in there. Make sure it's up there. Okay, all good in there now. Okay, I'll go ahead and replace this guy here. Oh, I gotta replace the collar here. This would be hooked up to something, so put that there. Really working with my hole there. There we go. Put that through there. Make sure that still stays there. Okay, got the new collar on there for you. Louis here. Okay. Make sure it's nice and secure there. Okay. Okay, after that I would go ahead and take off all my stuff. I don't need all this stuff on anymore. And we'll perform hand hygiene. Okay, perform hand hygiene. Okay. So then now I will make sure I put the side rail back up and everything. I will make sure the bed is in the lowest position it's locked, the call light is within reach, and then I will perform hand hygiene again before exiting the room.